This is a hero. He sees and hears things others can't. And Bait Gang. Hayek does it from a helicopter. This behavior is intentional, like opening a patient's lid.
Syndrome. Like it.
Oh, he called me.
So he's gambling?
Oh,
Hi, Dr. Friends.
Today isn't about medical history, it's about the trauma center. Goldenhauser drama.
So, how great must this work be to become a drama?
Anyway, they don't adapt just anything.
And
Plus,
you wonder if Netflix will pick it up exclusively.
Yeah, I'm curious. It's a medical hero action drama, not a medical show. Right, what's the extent of literary license? There's none. You'll see.
Let's
This
see.
is the standout episode. On Naver Webtoon, episode 5 is free. You can watch up to episode 8 for free. The man in the suit is Bak Kang Hayek, and he has a tattoo on his arm.
It's his first day at work. He came in a suit to introduce himself, but had an urgent call. So he couldn't change. He took a helicopter to where someone fell while hiking, rappelled down, but found no one. Watching
I
alone
see.
won't suffice. Why rappel unconscious? You should land first. This doesn't happen. Lifting an unconscious person is what doctor helicopters handle. You lower hooks and lift them. If not possible, you proceed. Wind could cause spinning, leading to damage. And there's a real case of it.
They know this doesn't happen in reality and added it because it's a fantasy.
It's a superhero story. Bait Kang Hike isn't human. Added for effect. That's right. I thought our severe trauma center system isn't endurable for normal people. Fixing it is a distant hope. So, I included Bait Kang Hayek, who solves everything to show my work's identity. In the next scene, Yamjae, one is captured.
For you crazy, let me down. I'd react the same.
Very realistic. Realistic people, but calm while descending due to the helicopter.
oh, I see.
He says he'll drop them. This personality was needed, not worrying about trivial things. If you have a goal, just go for it. Jumping off with someone on his back was unbelievable.
Never seen before.
First time seeing it. Standing with someone 70-80 kg on their shoulder. Could you do it? Could your wife? 7 kilogram. Your daughter.
I can handle my daughter. Even with one hand, easily.
Hey, handling your daughter, it is enough.
In a few months, it won't be easy.
After a year, it's tough, so just drop them.
On the ground.
Follow fast. They don't call names until skills are acknowledged. Initially called Inus, but officially becoming slave number 1 later. 1 implies 2 with an expanding story. A team is needed even for heroes. It's about forming a team and a center. A report was received, but since the person couldn't move, immediate rescue was impossible. The situation's critical, so a helicopter was dispatched. They approached the paramedic, not in a doctor's gown. Wearing a tattooed suit, he felt threatened. See, he's a doctor. How? How's he a doctor? That's my thought. Anus takes the stethoscope. No breath sounds. No breath in the lung. Maybe pneumothorax? It's a pneumothorax. Diagnose it, then release gas urgently. Disinfect and pop.
That's courage.
Not courage. Watch this. It's not human. Then checks eyes. We can see pupil constriction, but not papilledema. Like this? You should use an ophthalmoscope. But this person sees with the naked eye due to super sensors. In the novel, settings are revealed gradually, but the webtoon focuses on results. This Bait Karnak scene shows hero identity. He perceives what others can. A great surgeon. Sensika's finger, tactile surgeon. This is vital. It's crucial, but it's completely different from what we feel. Even if I touch an area that I can't see. With this sensation, it's still the same area and layer. As you go in the dermis, fat, muscle, through vibrations. Know there's a vessel ahead.
Arteries have slight tremors.
Bang, bang, we don't know.
How do you know? If blood gushes, it was an artery. So he was here. Baek Kang Haik knows these things. Nipple edema. The person beside it doesn't understand.
Nipple edema.
We need to perform surgery because the pressure's dangerously high in two areas, which means you'd have to go to a hospital. It's not something you do on land because it's challenging and risky. But Baek Kang doesn't do it the ground either. He actually performs it in a helicopter.
No dirt there.
Helicopter's
Safer.
clean. There's something called Airbus. It's more advanced than a doctor helicopter with an OR.
Like a ship.
Yeah, like that. It's a low vibration space.
Can't shake.
It's got extra seismic design.
It's a helicopter.
It's a helicopter, but more stable inside. There's a buffer. But no country officially uses it. Military or rental companies test it, but it wasn't available when I did it. Airbus just said it's possible.
This guy says he can do it in a doctor helicopter. He thought he might die, but realized the focus should be on the patient's condition, not fear of heights. If you take someone with acrophobia up and down, how do you think they'd feel?
They'd panic, feel chaotic, heart racing.
But being able to respond like this means he's no ordinary guy. Here, young Jay, Won's character, is a growing genius. By the end of the novel, Baek Kang, Hayek would trust him to run the center. He's not an ordinary guy. I wanted to show that. Someone who can keep up and follow through. He realizes it'll take 30 minutes to reach the hospital and thinks the patient's condition might worsen. So he says they have to open it up. This language was intentional. Some surgeons are rough in their manner. That's right, but not with patients. In front of the patient, they don't say, "We'll open you up." They speak like this among themselves for efficiency.
For example, quickly open.
Quickly open. But Yang Jae-won, being a comm model student, can't accept that. 9/11 would stop them since there's no OR.
They do it on the floor. Swelling worsens. They perform a tracheotomy. The direction was wrong. Open vertically. That's an emergency. Yes, sometimes it's vertical. It's easier. We do it. Baek Kang Haik does horizontal, then ambu bagging.
Meanwhile, memorize crew's name.
I remember names well, but potential disciples, I don't use names until I acknowledge them.
To give an impression.
Like Stockholm Syndrome?
Like that?
He said my name. You want to stay?
Call him that.
No, just one.
You have to give rewards randomly to make it more addictive.
He knew I didn't. Saying this spikes your dopamine.
Exactly. It's like gambling.
Why aren't you praising me this time?
If gambling paid out once every 10 times, no one would do it.
It's random.
Randomness?
That's what drives people mad. They keep trying, then shave their heads. But no clippers.
So scissors.
Perfect shave.
Because he's talented. What is this?
Dr. Wu Chang Yun is interested.
Dr. Wu Chang Yun wants this thick hair, but he's sarcastic, suggesting a switch to beauty.
Baek Kang must be surprised by the haircut.
It was decided he's my slave. Betadine, disinfect, pull scalp. Actually a lie. Perfect skull. Pressing doesn't raise pressure. He's difficult, knows but acts ignorant. Apologize slight. But his looks make everything seem plausible. I heard Ju Ji-hoon is a trauma professor.
We need surgery, or they die. It's different when Baek Kang says it. We proceed, but there's no drill here.
Cutting bone?
You need a drill, don't? You need a drill for bone. It's an old 19th century method. A hammer and chisel can make a hole. It's used in ENT, especially for crooked nasal bones, and was used for otitis media surgeries. The lack of lighting back then caused many FAV paralysis cases.
How to gauge?
You don't know. but his senses differ.
He's hypersensitive.
He's confident and can make it look good, so he goes for it. But it's such an absurd surgery that it's hard to depict in a novel.
It's easier to write than show in pictures. Smart direction, right? Writer Hongbi asked me. I'm thinking I could do it because I'm a doctor, but it's not possible. I suggested just showing the helicopter arriving, and the result. He survived. That's enough. So the helicopter arrives.
Nurse Rose, with her indomitable will, practically runs the trauma team alone. She's the only one who can control Baek Kwong Hayek. I've never seen a helicopter bring a patient because it causes hospital complaints.
Complaints
People
arise?
complain, patients and nearby people dislike it, so it wasn't feasible.
The head's in a state. Then they ask, anesthesia here. Dr. Wong once refused and got into trouble, so Dr. Park, another anesthesiologist, gets involved and proves good at it.
Anesthesiologists are called the captains of the operating room because while surgeons focus on the surgical area, it's the anesthesiologists who monitor vitals and patient conditions, ensuring everything runs smoothly.
That's
we
right.
focus on surgery while anesthesiologists oversee the whole operation affecting prognosis. This friend is still a resident. 4th year, we needed a fellow because it was surgery time. They insisted he come down acting tough, so he explained rationally. It wasn't his job, but they kept calling him, and the patient's condition was poor, so it was an emergency surgery. Right. Oh, nice guy.
I said I'd come down, not as a threat. I thought, all right, asking to open the OR is tough.
It's hard. Jang Mi got called a gangster once. So, we prepare for surgery. This friend isn't an OR nurse, but we're a team, right? There's a difference between nurses who've seen surgeries and those who haven't, especially with trauma. There's no routine. You know to watch this wound carefully after surgery, and any change is a big issue. But this part is okay to monitor. You know this without explanation, right? You're a medical professional. We train for it. He fell from 5 meters, BP 50-60, unstable. Remifenol, since too strong is bad, is used with ketamine, which raises BP. Doing this, I'm like, do anesthesia.
Boost BP. I asked the doctor, they don't use it much, but we could try. Ketamine's a good anesthetic, but delirium or hallucinations may occur. In ICU, we use ketamine, and they say they saw themselves in a coffin.
Oh, really?
But for lighter, wait pediatric
Yes,
cases
for
or
pediatrics,
pet
it's
surgery.
safe, so ketamine is used a lot. Here, I'll show off my learning. The heart is fine because
Heartbeat heard, right? You can just tell by looking. This one's quick, witted and fine. The helicopter's coming, but without reinforcement, vibrations are severe. It's costly, so they usually land elsewhere, which takes time to. They say it's due helicopter. Our chief raised yarn for all our jobs, but he got dragged in. It's unsettling. Dragged in.
Looks similar.
Oh, it's incredible.
Artist, I was shocked.
But this friend? Oh, clever guy.
He was smart, yet chose surgery. Proctology is the most popular, so he's elite. It's exciting to see what Professor Baek will show. He did a head surgery well. Trauma surgery usually doesn't handle heads. They do emergency treatment.
Oh, really?
But Baek Kwong Hayek is a master surgeon ending episode 5.
Wow. Listening to the original creator of the Netflix drama about the trauma center makes the characters feel much deeper.
understanding.
I think
Reviewed
so.
it. Watch the drama. It doesn't cover everything, so read webtoon or web novel instead.
The web
By
novel.
reading, you can level up and be amazed at how familiar scenes appear in the video, with many breathtaking moments making the drama more exciting.
If you binge, watch, and leave a lot of comments, we can do follow up reviews. So it would be nice to binge watch the drama together. Thank you.
Thank you.